Hey guys, Dr. Luke Stringer here, Advanced Health Chiropractic down in South Loop in Chicago. A real common question we get asked from our patients is exactly what is soft tissue therapy and how does it work within our care plans. So essentially, we're going to use a little bit of a diagram here, but when you evaluate soft tissue via biopsy under a microscope, it should look really structured and uniform. So essentially a lattice formation. Something like this. Don't laugh at my drawing here. However, repetitive stresses or serious traumas like sporting injuries or sitting at your desk 40-50 hours a week just beats the joint and the tissue up. And when this tissue gets beaten up, essentially it forms something called adhesion. Adhesion is essentially collagen, which is like scar tissue. It forms within a muscle and acts like glue. So essentially, instead of the tissue looking really structured and uniform, what happens is the tissue gets beaten up. So it starts to kind of look like this. So the body has to respond and heal that essentially, because you're not just going to walk around with a bunch of damaged tissue. So it's exactly what the body does. However, when it regenerates that tissue, it does so with that adhesion that we just went through. So adhesion fills in all these little gaps. Well, unfortunately, adhesion is essentially collagen, scar tissue. It's glue in a muscle, so it's weak and inflexible. So when you use a joint, your shoulder, for example, your hip, your knee, muscles, the tissue that anchors your spine, is weak and inflexible. So it's going to limit your range of motion. It's going to create compensatory patterns. It's just going to essentially create this negative circle of limited range, overcompensation, tissue breaks down further. And essentially, that's how we break down. So the soft tissue therapy we do here involves functional movement. We'll take you through a range of motion assessment of the joint. We'll evaluate the integrity of that soft tissue, take you through some orthopedic exams, and then we'll build out a treatment plan that incorporates treating that damaged soft tissue. When you break down the adhesion, it improves mobility, decreases your pain. Supplement that with some effective physical therapy, we can restore stability and function to the joint. So for that help, make sure you subscribe to our YouTube page, turn on the notification bell, like this if it's on Facebook, share with any family or friends that may be suffering with pain, and we'll see you in the next video.